Hello everyone, welcome back to Remedy OMM. Today, we will be going over an introduction to osteopathic techniques, so let's dive right in. Here are the topics we will cover today. Barriers are extremely important to understand when talking about techniques. We'll discuss direct versus indirect and active versus passive briefly before listing the technique types and talking about some special considerations to keep in mind for boards and for your future practice.
Looking to elevate your Comlex prep? Dive into RemedyOMM.com. Discover our comprehensive question bank, expert lectures, and personalized consultation services, all tailored for your success. Join the community of achievers. Visit RemedyOMM.com today and take the next step in your medical journey.
When manipulating the body, you have to understand that each joint has its own range of motion. The end point of that range of motion is known as the barrier. There are two normal barriers to know. These are the physiologic barrier, which is the maximal range of motion a normal person can get out of their body on their own. This is known as active motion. The other barrier is the anatomic barrier, which is the furthest any joint can go with assistance or passively. The anatomic barrier is the absolute limit. Going beyond the anatomic barrier will cause pain, tears, or even possibly fractures. Now, when someone has a somatic dysfunction, they tend to have restriction in their physiologic barrier. This new barrier is called the restrictive or pathologic barrier. And with this pathologic barrier comes a new neutral set point and a restriction in the overall range of motion. Looking at this vertebra on the left, I've labeled its normal range of motion and associated barriers. These range of motions are a bit exaggerated here to make a point, but anyways. Here you can see that we are completely neutral. Here we have anatomic barriers, the absolute limits, and here we have the physiologic barriers. When a patient has a somatic dysfunction, like over here on the right, this patient is rotated right. You can see that we have a new neutral, a new set point. This creates a new barrier, a restrictive or pathological one. That comes with a decreased range of motion. By using osteopathic techniques, we help heal and correct this restriction to restore the normal range of motion. Before we discuss techniques, we need to go over some terminology that is extremely important to understand for practice and for your exams. The first category we need to be aware of is indirect versus direct techniques. Since we just went over barriers, this should make sense that for indirect techniques, we move the patient away from the restrictive or pathologic barrier. This may relax tight muscles that are pulling on a joint with too much tension and help ease the restriction. I like to think of this as moving a patient in the direction they want to go in. Direct techniques are the exact opposite, where we move a patient towards the restrictive barrier and try to restore the neutral barrier by either stretching, strengthening, or even forcing a joint or muscle to go back to that neutral position. Think of this as moving a patient in the direction they do not want to go in, one that would create a little more tension but then lead to relief. High velocity, low amplitude, or HVLA, is the classic direct technique. That's the kind of technique you see the chiropractors do, one that creates a little more tension as the practitioner forces the patient towards the direct barrier and then sometimes has a satisfying crack or pop that releases the tension and restores alignment. The second category of techniques is active versus passive. Passive techniques are those in which the patient does absolutely nothing. They do not assist in the treatment at all, and the physician or practitioner is the one doing all the work. On the other hand, we have active techniques. These are techniques where the patient assists the practitioner by actively moving a joint in a certain direction. It is important to understand the differentiations between both indirect versus direct and passive versus active when it comes to using techniques, as you will be tested on this. Here we have listed out a table of the techniques we use in osteopathic medicine. This is not something you have to memorize. It will come with intuition as you learn more about OMM. In these last two slides, we'll cover some finer points to help guide your osteopathic treatments. The first thing you're going to want to understand is the order of treatment. First things first, always treat the axial skeleton before treating the extremities. An easy way to think about this is to treat central dysfunctions before treating peripheral dysfunctions. A good example for this is that you are going to want to treat the thoracic spine before manipulating the ribs. Along those same lines, when it comes to extremities, treat proximal to distal, proximal to distal. And for lymphatic techniques, always treat the thoracic inlet first before doing any lymphatic treatments. This question comes up so many times on board exams. So always remember, open the drain first. The last topic we're going to consider is subtle but important. You have to understand that not all techniques are acceptable to use on all patients. There are recommendations and even contraindications to performing some techniques. First, for elderly or hospitalized patients, use indirect techniques. This is pretty straightforward, as the elderly and weak cannot tolerate going against the barrier as well as healthy patients. Second, use indirect techniques for acute situations. When someone comes to you with an acute injury, you don't want to exacerbate their problems by trying to push through a barrier. In these patients, a barrier is present secondary to the injury or pain, and pushing through with a direct technique won't treat their problem and only make matters worse. The third consideration is to avoid lymphatic techniques in patients with advanced stages of cancer and/or congestive heart failure. This is a bit more far-fetched, but there is theory to suggest that increased lymphatic return could add more volume to a patient's cardiovascular system, adding more stress on the heart. And also, there's ideas of potentially seeding a cancer through lymphatic system flow. Take from that what you will, but at least recognize that these ideas exist. Lastly, for osteoporosis, rheumatoid arthritis, and bone cancer, as well as achondroplasia, avoid HVLA techniques, as these maneuvers may apply too much stress to the patient's body with these pathologies. That's all I have for you guys today. Thanks for watching. Please like and subscribe. Your support means the world to us and our channel. If you have any questions, please don't hesitate to comment below. Check out RemedyOMM.com to take your osteopathic skills to the next level. We will see you guys in the next lecture.